Hey everyone, my name's Kelly. I am the owner of Champ Therapy and Wellness. It is a mobile outpatient therapy service. I come to your home, I come to your work, I come wherever you want me to meet you, providing outpatient therapy in the comfort of your own home or your own personal space. I also do virtual visits. I do physical therapy, occupational therapy, and then I provide the same services with personal training as well. I'm here today to talk to you about the benefits of exercise with Parkinson's disease. So I did this presentation at an independent living facility. I wanted to answer all their questions. So we started with questions right away. Their main questions were kind of about the different movements and exercises they could use. But you'll see my contact information at the end here, and feel free to reach out to me with any questions. I'd be happy to help. So Parkinson's, it is a movement disorder. That's what it's commonly referred to. Everyone's different. Everyone has different symptoms, but the most common and primary movement symptoms that you see are tremors, both in the hands and the feet, slowness, rigidity or rigid movements, which is stiffness, postural instability, so you're off balance, you're falling a lot. This picture here shows the area of the brain that's usually impacted. That's the substantia nigra, and that's in the basal ganglia. It's the dopamine producing cells. So basically you have a decrease in dopamine, which we'll talk about in a little bit here. So you also see the Parkinson's gait pattern, Parkinsonism. So that's usually the small steps. You're leaning forward, you're slow to initiate. Sometimes you have freezing, so you actually stop and physically feel like you can't step. Quick steps, decreased arm swing. The picture here shows you some more common symptoms. So usually like a flat affect in the face, so a masked face. You can't really read the face in terms of feelings and thoughts. Shuffling gait, which was on there. So shuffling, walking, tremors in the legs, tremors in the hand, forward tilt of the trunk, that stoop posture. Common signs. So why is this occurring? There's a decrease in dopamine, like I said, in that basal ganglia. That's where they're impaired, at least dopamine cells, and dopamine controls movement. So that's why it's a movement disorder, because you don't have proper dopamine to control your movement. So small movements are super common in Parkinson's. So you want to think big, you want to go big. The goal is to decrease falls, improve quality of life. And it's been proven that exercise can slow the progression of Parkinson's. There isn't a cure, but it can slow the progression. You can improve your balance, decrease freezing gait and shuffling gait, which is walking, improve motor skills, improve endurance, decrease depression, improve cognition. So actually a really neat thing to do for freezing gait. So that's where you kind of walk and you get stuck. Can't quite take that next step. The U-step. The U-step is a type of walker that a lot of people with Parkinson's with shuffling and freezing gait will use. It's actually the opposite of the normal walker. You have to pull up on the handles or the so-called brakes to allow it to move. And then when you let go, the brakes are on. But some of them come with lasers, and what that does is it puts a line right in front of where you're walking as a visual cue for you to step over it and unlock that freezing gait pattern. Now, those are super fancy walkers. Not everyone has them. So what I use is I practice with therapy by either duct taping a line, using the side of a cereal box, whatever it is, a line for something that's a visual cue to step over and just practice stepping over. Or if someone freezes during walking, just remind them, okay, imagine a line, step over it. And that usually knocks you right out of that freezing gait pattern pretty quick. So it's recommended to get 30 minutes per day, 5 days a week, 150 minutes per week. You can build up to a consecutive 30 minutes if you have to do 10 minutes in the morning, 10 minutes at lunch, and 10 minutes at dinner. Totally okay. So safety first. You want to make sure that you have fall prevention, fall training. You want to make sure you know how to do a floor transfer. Balance is very affected with Parkinson's, very common for falls. You want to make sure you're safe. So if anything, I recommend scheduling a physical or occupational therapy evaluation, at least for home safety. Have someone come out, check out your house, make sure it's safe. Get educated on ways you can make it safer to not fall. Get educated on how to perform a floor transfer if heaven forbid you do fall. Sometimes it just takes that one visit just to make you aware of things. Sometimes you need more than the one visit. It varies person to person, but highly recommend checking out the safety of your home. Safety first. So this here is my contact information. Again, feel free to reach out to me with any questions, or if you want handouts that I provided my in-person webinar that I did, I'd be happy to send them your way. The biggest thing with Parkinson's is thinking big. Parkinson's, you have a tendency to move so slow, to interpret slow motions. You want to move big. So someone with Parkinson's will look at me, and if I take a huge step, a huge leap forward, they're going to think I look silly, I look ridiculous, and I'm going to tell them to do the same thing. When I tell them to do the same thing, they actually take a normal step because of how their brain processes it and how their brain tells their muscles and body to move. So they think they're looking as ridiculous as I am, taking a huge step, but they're not. They're actually taking normal steps, and you kind of have to instill that in them to make them realize that that's the proper way of moving. I remember my grandma had Parkinson's, and she went through a big and loud program. So big is the PT/OT, physical therapy, occupational therapy side of things. Loud is the speech therapy side of things. I'm not going to speak to the speech therapy side of things. That's not my expertise, but definitely recommend if you're having some trouble with speech. A lot of Parkinson's patients are soft-spoken, to reach out to a speech therapist. My grandma had that issue, and I just remember after she went through it, she would always just tell me, she'd be like, Kelly, am I yelling at you? I feel like I'm yelling. And I'm like, no, you're actually speaking normal. But in her head, she felt like she was screaming at me, when in reality, it was a normal tone. And it's the same thing with the big portion, with the movement portion. They think they're taking this huge, outrageous step, but it's actually a normal step, and they're actually clearing the floor, decreasing the risk of tripping on things. So that's the biggest thing. If you notice a lot of movement symptoms with Parkinson's in yourself or a loved one, I highly recommend seeking out a nearby big and loud program or big program to complete. A true program, I believe, is about 4 days a week for 4 weeks. Don't quote me on that. I am not certified, as a disclaimer, but definitely you can just kind of Google big and loud LSVT online and find a nearby program for you or a nearby certified therapist. Again, any questions, you want any resources related to the things that I went over today, feel free to reach out. I'm happy to help whoever I can, and I hope you guys all have a good day. Thank you.